This is our first episode of podcast where we discuss about healthcare, or maybe you can say more in health informatics, what it is, and general brief idea about what it involves. I am your host, Sai Kiran.
And I am Navya. I completed my undergrad in Bachelor's of Dental Surgery, and I'm also an international student like Sai. And my co-host is Manisha here.
Hello, everyone. This is Manisha Jagdishnimani here, and I'm also an international student. And I did my undergrad in dental surgery and currently pursuing masters in health informatics.
It's a privilege to welcome our Professor Dr. Hamid Jalal, who's teaching health informatics and also works in patient safety division at AHRQ as a physician.
But
Okay.
when I met is like your personal story, Sai. Where are you from? Where did you come from? Why did you decide to pursue this program out of all the other different options that you had? Is it in line with your previous professional career in life?
I'm from Andhra Pradesh, India, and I completed my bachelor's in PharmD. After graduation, I worked as a medical coder for a few years. That job helped me understand how important accurate health data is in patient care. I began to notice inefficiencies in data handling and gaps in how information was used in clinical settings. This made me curious about how technology and data could be used to improve healthcare systems. After taking a deeper look into all the available fields, health informatics felt like a natural next step. Combining my pharmacy background with my interest in healthcare data, it allowed me to stay in healthcare field while contributing to better systems, safety, and patient outcomes.
Yes. So
Yes, I highly recommend this course coming from a healthcare background and having worked as a dentist. I believe any student or professional with a healthcare background can benefit greatly from it.
Okay,
yeah.
Manisha.
Okay, so I'm from Karachi, Pakistan, and I was working as a dentist for 5 years, and I was doing my residency in prosthodontic department, and then dealing with patients and history and treatment plans. So I saw some limitations in the traditional system back in Pakistan. My post graduation, but then also I don't wanted to do something like which is already in Pakistan. So I came across with this health informatics degree, and then when I dig down and then research about it, and I got to know that it's about health and IT. So basically, I went for this degree. Reason is that like to bridge the gap between clinical practice and the health IT as world is moving towards the more towards the technology. Currently, I'm in my second semester, so I have learned a lot of the things through this course.
For those students who may be pursuing this program in the future, coming from either India or Pakistan or from whichever, with similar backgrounds as yours, would you suggest that they go into this?
Yes, but
Uh, Get at least a basic knowledge about like Python or SQL because those are the main tools which will be used to process the healthcare data.
Okay, Navi as Manisha.
Yes. I obviously say yes. I'm good into this, so
Okay.
it's good.
Yep.
Same. I would suggest people to join this course.
Okay, great. So let me do a little brief introduction about my background and what led me to come to this particular field. So when I was in school, the use of technology in healthcare was like, was in the beginning, in the initial phase where EHRs were being implemented. We were transitioning from paper charts to the use of electronic health record. And now with time, what we're seeing that this technology is moving to the next phase. So as students and future professionals in the field, what's important for anybody who's in the program or thinking about pursuing the program is that there's a lot of potential as a career for to be in the for in this specific field. Now, when I say that, you also need to understand what that really means. So does that mean that all three of you, just the three of you, besides all the other students that are in the program, what should you be thinking about? So that's where once you get into the program and as you begin your career and you start learning, interacting, and talking to different people, it's important for you to say, this is what I'm really interested in. Now, what that could be, I want to stay in pop, like I love the population health impact of the use of technology. I want to work in a hospital setting. I want to work for like a consulting or some form of contracting for the federal or the state or at the local or private sector. Or do I want to be involved in the policy? So those are different types of fields that once you get in, you will sort of like start exploring. So I've also seen some students who want to pursue further degrees. So some of them who've graduated with a master's degree are now pursuing a PhD program as well. So that could be an option. So instead of going into the whole academic, like this is the definition of what health informatics is, essentially to really make it easy, it's the use of technology to improve how care is provided. If it can do what it's intended to do, if it can improve patient safety, it can cut costs, then the whole idea behind investing in something that you could have done prior to the use of technology, that's where you not only know whether or not something is working, but you can use data to do an analysis of did it actually improve. So for example, last year they were I'm just making up a number. There were 100 in the last 5 years. There were at least 100 patients that died from sepsis while they were hospitalized. With the use of technology or health informatics, the number has gradually improved with the use of various measures. You can actually say that it's come down to, let's say, 70, right? So you can't just be like, I think this is working. It has to be, it is actually working, and this is how I can prove it. Okay, so when you're approaching health informatics, that's how you should be thinking about it as well. Okay, so I know that you guys are relatively new to the program, but share some of the things that you have seen from the others so other students could, like if somebody has questions from you and they're from India or Pakistan and they're interested in the program, can you provide them some form of guidance? And if so, how? Please summarize your thoughts. Keep it brief.
I would say don't get confused because there are several branches in health informatics like bioinformatics and radiology informatics and so on and so forth.
Okay, that's an excellent point. Can I just hold you to that? So you just may have mentioned bioinformatics, and then you said imaging or radiology or the use of informatics. What are some of the other types of informatics besides what you just mentioned?
There is population health informatics.
So there's informatics that's specific to patients. So that's consumer health informatics is one of them, right? So when you say bioinformatics, how is bioinformatics different than health informatics?
Bioinformatics helps us understand disease at the molecular level, whereas health informatics helps us deliver better healthcare at the patient and system level. They are complementary.
That's
Good.
EHRs and everything.
So yes, so the idea is in the future, going back to why are we doing this to begin with, right?
Yeah.
The whole purpose of this is healthcare is focused on providing better quality of care to the patients. Ultimately, does the work you provide improve the quality of life of the patients? Does it improve their longevity? Can it cut costs on the overall healthcare? Those are some of the questions. So as we're moving to newer things, such as the use of AI that you guys will be learning in the program, as well as which is the use of genomics, which you just mentioned, combine all of that to come up with something which is called precision medicine, which we have discussed. Can you tell us a little bit about why precision medicine is so important for the future?
Every individual is different because their genetic makeup is different. So
Precisely.
it's like one shirt doesn't fit everyone. So there may be differences. Even slight modification, the way they are treated, can have a significant effect of their healthcare outcomes. So tailoring a treatment procedure specific to that individual has a significant effect, I would say.
Good. Okay. So yeah. And the idea behind the world that we're moving towards is where typically in the past, if you did some form of research, as we're moving and we're seeing some of the changes occurring. So one of the good things about health informatics is that it's a dynamic field. So if we are talking about a subject that was relevant maybe perhaps a few years back, may not be relevant anymore because we're moving so quickly that we need to keep ourselves up to date on what those changes are. So one of the key things is to think about is like in the past, if you wanted to do some research and bring something that's a better product, we see it in with the prescription medications. So if there is a new medicine that's coming out in the field, it would typically take years for you to do the testing and stuff before it was ready to be used on patients. So that sometimes caused a lot of harm or delayed in something that could be done better. We're going to see the same thing when we see the use of AI because it's done in a pilot setting prior to it being used for real patient care. That time frame that needs to come down. So some of the work that you could be doing once you're in the field is to reduce that time so it's ready for prime time and it could be used for patients as well. Okay, so today I wanted to keep this a very high level overview of health informatics, talk about some of your backgrounds as well. I hope we learned something good from this brief talk. Next time we'll talk about some new topic. We'll dig deeper into specific subjects that pertain to it, and then we can share some of that and be ready to respond to some of those questions as well. On a final thought, the question that I asked, is it okay for some student who may be interested in pursuing this program, would it be optional for them to reach out for you guys to have you provide some guidance to them as what to expect, whether or not they should choose the program, and what are some of the steps that they could do to join the program?
We will include our email IDs in the description so they can reach out to us directly, and feel free to drop their questions in the comment section. We'll be happy to answer them.
Great. Well, thank you so much. It was really great talking to you. I look forward to our next session. Thank you.